Hey guys, this is Curtis Alexander. I'm a pharmacist. In this video, I'm going to be reviewing the prescription medication Meloxicam, and really the point of the video, I want to answer the most common questions that I've got over the years for people who start on Meloxicam. We'll cover what it's used for, the common dosages, side effects, those sorts of things. So I want to hop right into it. So what we'll start out, what's it used for? So Meloxicam is an NSAID, a non-steroidal anti-inflammatory drug, and another common question or common drug that you'll see in that class, which is available over the counter, is ibuprofen. So with NSAIDs, in particular Meloxicam, what we're going to use it for as an anti-inflammatory is, of course, we're going to knock down inflammation, particularly in arthritis, rheumatoid arthritis, osteoarthritis, and also help with those pain levels in those disease states. The dosage, most people, depend on the formulation, there's different ones available. You're going to start out anywhere from 5 to 7.5 milligrams once a day. Depending on how you respond, they can bump you up to 15 milligrams a day. Some people will go higher, although it's not recommended, and I'll talk in a bit why that's the case. Now, mechanism of action, what does it actually do in the body? So if you've heard of Celebrex, Celebrex is a cyclooxygenase 2. It's an enzyme in the body that blocks inflammation. Meloxicam blocks COX-1 and COX-2. Now that's good and bad. What the end result is we can see fever go down, we can see pain go down, and inflammation go down. And we'll talk about why that's potentially bad here in a few minutes. Can you take it with alcohol? It's not recommended. Now, people always kind of roll their eyes and are like, hey, I can't even have a glass of wine. The long answer, well, let's do the short answer is, I have to tell you, no, you can't take it with alcohol. Some people can get by with a little bit, but the problem with alcohol is it can compound the stomach side effects that we can see. So generally speaking, try to avoid it. Smoking is also not recommended for the same reason that we don't recommend alcohol. Okay, can you use it in the elderly? It's not our first choice. It's on what's called the Beers list. The Beers list is a group of medications we don't want to see in the elderly. The reason why is 65 and older, we can start running into more side effects. Do you see it? You can see it. It's just not recommended. Okay. Do you need to take it with food? We're about to get into the side effects here. If you take Meloxicam, some people can take it without food and they're fine. If it causes stomach upset, yeah, go ahead and take it with food. The basic answer is you can do either or. It's up to your particular situation. Now, as far as the side effects we're going to see, this is important to know. The main ones are going to be GI or stomach side effects. Weird enough, we can see constipation and diarrhea. Usually we're looking at around 8% of people will get that. Same with indigestion, 6 to 8%. So stomach is the big one here. Now, an important warning, CV, cardiovascular. If you've had any sort of heart issues in the past, we have to be very careful about using Meloxicam. It's been linked to heart attacks, can even cause death in people who have previous cardiovascular problems. So make sure to talk to your doctor about that before you get going. And the biggest reason why, when you're, an NSAID will block what's called prostaglandins. They're involved in the inflammatory process, and that sounds great, but not all prostaglandins are bad. There's a substance called prostacyclin, which kind of links back to this cardiovascular part. So blocking that is part of why we see these cardiovascular warnings. So blocking prostaglandins, not all good. How about drug interactions? Mainly, you don't want to take this with other NSAIDs. So if you're prescribed Meloxicam and you have some breakthrough pain, some people will reach for an ibuprofen. It's also an NSAID, so it's going to increase your risk of these stomach side effects and so forth. So that's no bueno. You don't want to do that. Can you take it long term? Should you take it long term? No, you should not take it long term. A lot of people end up doing that because it provides them with pain relief. But again, we're coming back to an increased risk of these side effects. So, we really want to be using it on a short-term basis. How long will it take to work? You're going to see peak blood levels hit at anywhere from 2 to 5 hours. It depends on the formulation, it depends on the person's metabolism, those sorts of things. But within a few hours, you should start to notice some relief. And this is kind of a funny question. People are like, well, I've heard that it's a really strong NSAID. That's kind of a misnomer. I've had people that are like, man, ibuprofen is the only thing that works for me. It's the best one, and it's available over the counter. The problem with something like ibuprofen is you have to take it very frequently, every 4 to 6 hours. Meloxicam's once a day. So it's always a balancing act. It's always dependent on the individual person and how they do those things. So is it the strongest? I don't know. It depends on you, and it depends on how you react to it. So that's some of the more common questions. What I would like from you, please let me know in the comments. Have you taken Meloxicam before? Do you know anybody who has? Did you experience side effects? Did it work for you? Those sorts of things. It's helpful for the other folks that watch these videos, and it's helpful for me to get that feedback from people. It's something that's has a lot of value. Speaking of value, I hope this video was helpful, and I'll see you in the next one. Thanks.